Hi, I'm Lorenzo, fourth year student in the University of Santo Tomas, tired physical therapist student, and now the new ambassador of the TENDSMED S82 by Thank you, I know. It takes a lot to look this good. But what's the TENDSMED S82? I'm glad you asked. TEND stands for Transcutaneous Electrical Nerve Stimulation. Now here are some of the indications. Both acute and chronic pain. Two birds, one machine. Bam! Muscle stimulation and re-education. Atrophy, bye! Precautions? Yes, there are precautions. Decrease sensation and mentation. You don't want to be thinking that it's all okay when it's all going burn, burn, burn. Profuse sweating. Sweaty hands gonna make that electricity go bam. So you don't want that. Contraindications, which make the TENDSMED obsolete. Patients with cardiac pacemakers. Open wounds over the carotid artery. These are the things that make the TENDSMED machine a big no-no in treatment. So here's how you can use the wonderful TENDSMED S82 by Yes. So here's how you can use the TENDSMED S82. You can start it off by pressing the power button. You'll be seeing the preset, PP3. It can actually be PP2, PP4, doesn't matter, these are all presets. Long press. You will be brought to a screen like this. Now, press the P+ once more, you'll see a C, which stands for continuous. You can change it to intermittent, but we want the C. Press the P+ once more, you'll be seeing a smaller C. Press the P+ once more, you'll be brought to the hertz. It's already set to 80 hertz, which is what we want, so you don't have to adjust that. Next, you'll be brought to the microseconds, which is set to 180. We want it down to 100. Long press once more, you'll be brought to the time. You want the time to be set at 20 minutes. One more long press, and your parameters are set. Now, if you want to start, you could set the intensity first to the patient's comfort, by the way, then long press the P+. And you're set. It's already starting. This time will represent the ones here. But why use the TENDSMED S82? One perfectly good explanation. The gate control theory. Well, what's the gate control theory? Let me explain, honey.
Gate control theory. Pain stimulates the nerve fibers A, beta, and C. They're responsible for taking the pain nerve stimulation to the brain. The A beta fibers are responsible for pain that is acute and immediate. And the C fibers are responsible for the pain that incapacitates. The electrical stimulation of Tanix comes in different settings according to pain frequency. It acts directly on the nerve fibers A beta, interrupting the transmission of pain stimulus, causing the closing of the gate control theory, releasing of endorphins, and local parenthesis, stopping or decreasing the pain at the site.
Now, do you get the gate control theory? Good. Let's move on. Let's learn how to do electrode placement. So, let me explain how you can get the machine to have the electrode so you can start the treatment, okay? So, we get two electrodes. So freaking cute. Oh my god. Ah! And you get the wires. Now, placement of the wires is super simple. You can see that this wire is for the black, this is for the red. Now, simple is just putting it into the hole of the electrode. Next, one more, and you're set. All you have to do now is choose the channel. There's two in the S82 by Yes. So I'm gonna choose the right. There, you're set. So sir, you're about to undergo the beautiful machine called the TENDSMED S82. I got that, yes. The machine will be used to inhibit the pain you're feeling in your lateral side of the elbow. So first thing you have to do is, of course, inspect the area. You have to check if there are any wounds, any ulcers, any other problems that could be a contraindication in the use of a TENDSMED machine. Next, you have to ask the patient, sir, do you have any cancer, any metals in the area, any other problems that I should be aware of? None. So after asking about the contraindications, next thing you have to do, apply the gel. Put it on the flatter surface, the one without the brand. There we go. Now, apply it to the next electrode and spread. There we go. Pause. Now, position the patient to expose the area. So, sir, please bring your arm a little forward here. Ask him again, sir, where's the pain again? In this area. So now, I will apply the first electrode here. Get some tape. Crosswise. The next electrode. Sir, would it be okay if you can hold the electrodes first? Same way, in an X pattern. Next, inform the patient about what he's about to feel. Sir, may mararamdaman po kayo na panglanggam na naglalakad sa side po ng arm. Pero okay lang po. Sabihin niyo lang po sa akin kapag may problema po kayo naranasan kung sumakit bigla o matibang pakiramdam na nararamdaman po. Okay? Once the treatment's over, remove the electrodes as carefully as possible as to not hurt the patient. Clean the patient off. And the electrodes. Finally, ask the patient, so sir, how do you feel?
Feel better.
You feel better. How's the pain?
It's almost
Almost gone. The wonders of the TENDSMED S82. I suggest you all start trying to get a new machine as well. Thank you, Roger. This beautiful machine could be used by you if you enroll into the 4th year physical therapy class of PT4 electrotherapy. Innovative, inspirational, passion for motion. The TENDSMED S82